Hello students. Now we're going to review hepatitis. Hepatitis is the widespread inflammation and infection of liver cells. Viral hepatitis, which can be acute or chronic, is the most common type. Less common type of hepatitis are caused by chemicals, drugs, and other herbs. This section discusses hepatitis caused by virus. Viral hepatitis results from an infection caused by one of the five categories of viruses. We have hepatitis A virus, hepatitis B virus, hepatitis C, D, and E. Liver injury with inflammation can develop after exposure to a number of drugs and chemicals by inhalation, ingestion, or parenteral IV administration. Toxic and drug-induced hepatitis can result from exposure to hepatotoxins, industrial toxins, alcohol, and drugs. Hepatitis may also occur as a secondary infection during the course of infections with other viruses, such as Epstein-Barr, herpes simplex, varicella zoster, and cytomegalovirus. Hepatitis A, the causative agent of hepatitis A virus is a ribonucleic acid virus of the enterovirus family. It is a hardy virus and survives on human hands. The virus is resistant to detergents and acid, but is destroyed by chlorine, bleach, and extremely high temperatures. This is good to know, right? It is spread most often by the fecal-oral route, by fecal contamination, either from person-to-person contact, oral anal sexual activity, or by consuming contaminated food or water. Common sources of infections include shellfish caught in contaminated water and food contaminated by food handlers infected with hepatitis A virus. The incubation period of hepatitis A is usually 15 to 20 to 50 days, with a peak of 25 to 30 days. Widespread damage that requires a liver transplant in some cases. When the patient immunity is decreased, death may occur. The incidence, of course, when this disease becomes chronic, right? The incidence of hepatitis A is particularly high in non-affluent countries in which sanitation is poor. However, cases are diagnosed internationally across the globe. So hepatitis B, the hepatitis B virus is not transmitted like hepatitis A. It is a double-shelled particle contaminated DNA composed of a core antigen, a surface antigen, and another antigen found within the core that circulates in the blood. Hepatitis B may be spread through these common modes of transmission. So it could be unprotected sexual intercourse with an infected partner, sharing needles, syringes, and other drug injection equipment, sharing razors or toothbrushes with an infected individual, accidental needle stick of injuries, blood transfusion, hemodialysis, direct contact with the blood or open source of an infected individual, birth, spread from an infected mother to baby during birth. Symptoms usually occur within 25 to 180 days of exposure. That is another difference between hepatitis A and hepatitis B. Hepatitis carriers can infect others even though they are not sick and have no obvious signs of hepatitis B. Chronic carriers are at higher risk for cirrhosis and liver cancer. Because of the high number of newcomers from endemic areas, the incidence of hepatitis B has increased in the United States. Hepatitis C is the leading cause of end-stage liver disease in the world. The causative virus of hepatitis C is an enveloped single-strand RNA virus, which is genetically unstable and has at least 6 known major genotypes. Transmission is blood to blood. The rate of sexual transmission is very low in a single couple relationship, but increase with multiple sex partners. or in men who have unprotected sex with men. So you have illicit IV drug needle sharing, blood products, or organ transplant received before 1992. And that's something that you have to remember. Is possible an NCLEX question. Baby boomers, those adults born between 95 and 65. That's another NCLEX question for sure. Needle stick injury with HCV contaminated blood, hemodialysis, healthcare workers, people who are incarcerated, sharing of drug paraphernalia. The disease is not transmitted by casual contact or intimate household contact. The incubation period ranges from 2 weeks to 6 months. Unlike with hepatitis B, most people infected with hepatitis C do not clear the virus and a chronic infection develops. That's very important. Scarring from chronic infection with either hepatitis B and C frequently leads to cirrhosis, which is a risk factor for developing primary liver cancer. And this is very important to remember. Very important to remember. People with hepatitis C do not clear the virus. Important to remember. Never tell patients that with hepatitis C that the disease will resolve in a specific period of time. You never tell the patients that. Important to remember. Hepatitis D. Okay. Okay. It's not working. Hepatitis D. Okay, thank you. The delta hepatitis is caused by a defective RNA virus that needs the helper function of hepatitis B. It occurs only with hepatitis B to cause viral replication. The incubation period is about 14 to 56 days. As with hepatitis B, the disease is transmitted primarily by parental routes, especially in patients who are IV drug users. Having sexual contact with someone with hepatitis D is also a high risk factor. Hepatitis E. The hepatitis E virus causes a waterborne infection associated with epidemics in the Indian subcontinents, Asia, Africa, and Middle East, Mexico, and Central and South America. Many large outbreaks have occurred after heavy rains and flooding. Like hepatitis A, hepatitis C is caused by fecal contamination of food and water. In the United States, hepatitis C has been found only on international travelers. It is transmitted via the fecal-oral route, and the clinical course resembles that of hepatitis A. Hepatitis C has an incubation period of 15 to 14 days to 64 days, There is no evidence at this time of a chronic form of the disease. The disease tends to be self-limited and resolves on its own. Complications of hepatitis is considered to be chronic when liver inflammation lasts longer than 6 months. Chronic hepatitis usually occurs as a result of hepatitis B or C. Chronic hepatitis can lead to cirrhosis and liver cancer. Many patients have multiple infections, especially a combination of hepatitis B with C, D, and HIV infections. Okay, let's move to incidence and prevalence. Hepatitis B and C are a concern because of their association with cirrhosis and liver cancer. Although exact numbers are not known, it is estimated that over 170 million people worldwide have the hepatitis C virus, with 3 to 4 million new cases occurring every year. It is the most common chronic bloodborne infection in the United States. Most hepatitis A infections in the US today occur in patients who have drug abuse or those who are homeless. Health promotion and maintenance measures for preventing hepatitis A in adults include proper hand washing, avoiding contaminated food or water, receiving immunoglobulin within 14 days if exposed to the virus, receiving the hepatitis A vaccine before traveling to areas where the disease is common, receiving the vaccine if living or working in enclosed areas with others, such as college dormitories, correctional institutions, daycare centers, and long-term care facilities. Several hepatitis A vaccines are made of inactivated Hep A virus and are given in the deltoid muscle. Several vaccines can also provide protection against hepatitis B virus infection. A combination of hepatitis A and B vaccine is available for adults. Example of group for whom immunization against Hep B should be in use include people who have sexual intercourse with more than one partner, people with sexually transmitted infection or history of STI, men having unprotected cells with another man, people with any chronic liver disease such as hepatitis C or cirrhosis, patients with human immune deficiency virus HIV infection, people who are exposed to blood or body fluids in the workplace, including us, nurses, healthcare workers, firefighters, and police, people in correctional facilities, patients needing immunosuppressant drugs, family members, household members, and sexual contacts of people with hepatitis B infection. You have to teach the baby boomers adults to have a one-time screening test for hepatitis C due to the high risk of this infection in this population. Best practice for patient safety. Prevention of hepatitis, of viral hepatitis in healthcare coworkers. Use standard precautions to prevent the transmission of disease. Eliminate needles and other sharp instruments from substituting needleless systems. Take the hepatitis B vaccine, which is given in a series of 3 injections. Or maybe if you need a booster, probably it's going to be a series of 2. For post-exposure prevention of hepatitis A, seek medical attention immediately. For immunoglobulin, report all cases of hepatitis to the local health department. Assessment. Begin by asking a patient whether or not they have been exposed to a person with hepatitis. For the patient who present with fever or no symptoms of liver disease but an abnormal laboratory test, elevated alanine aminotransferase ALT or AST level, the history may need to include additional questions regarding risk factors, physical assessment and symptoms, viral hepatitis, yellowish sclera icterus. The arthralgia is basically a very significant symptom and it's very common. Myalgia also. Like clear color stools, dark yellow to brownish urine, jaundice, dry skin, pruritus. Those are the most significant symptoms, right? So remember the COS is all about colors and skin. When you are checking for the symptoms of viral hepatitis, you see the yellowish sclera, the light gray color stools, dark yellow, jaundice, and the skin, right? Dry skin, pruritus. It's all about colors. Lightly palpate the right upper abdominal quadrant to assess for liver tenderness. The patient may report right upper quadrant pain with jarring movements. Inspect the skin, sclera, and mucous membrane for jaundice. Patients with chronic hepatitis C infection often have extrahepatic complications. Complications. Depression, polyarthritis, myalgia, renal insufficiency, cognitive impairment, cardiovascular problems. And these complications are very important to know. Very, very, very important to know. Psychosocial assessment. Viral hepatitis has various presentations, but for most infected people, the initial course is mild with few or no symptoms. The long-term complications of fibrosis and cirrhosis cause the more serious problem. This is especially true for patients who have chronic Hep B and Hep C infection. Emotional problem for affected patients may center on their feeling sick or fatigue. General malaise, inactivity, and back symptoms contribute to depression. Some patients often feel guilty and are remorseful about decisions made that caused the disease. These feelings are most likely to occur when the source of infection is from drug use. Yeah. Laboratory assessment. Hep A, B, and C are usually confirmed by acute elevation in levels of liver enzymes, indicating liver cellular damage, and by specific serologic markers. Elevated ALT, we know L of liver, S is related to brain, heart, muscle, may possible rise into the thousands in acute or fulminant cases of hepatitis. Alkaline phosphatase levels may be normal or elevated, and remember this marker is more related to bones. Serial total bilirubin, the serial total bilirubin levels are elevated and are consistent with the clinical appearance of jaundice. The presence of hepatitis A is established when hepatitis A virus antibody are found in the blood. Ongoing inflammation of the liver by hepatitis A is indicated by the presence of immunoglobulin M antibodies, which persist in the blood for 4 to 6 weeks. Previous infection is identified by the presence of immunoglobulin G antibodies. So the way I remember this is if the patient is having the immunoglobulin M, the presence of M means malaise, means that the infection is ongoing, the inflammation is ongoing, there is malaise. And if you find immunoglobulin G, means that the inflammation now is good, is resolved, good, antibodies. These antibodies persist in the serum and provide permanent immunity to hepatitis A. The presence of the hepatitis B is established when serologic testing confirms the presence of Hep B antigen antibody systems in the blood and a detectable viral count polymerase chain reaction. Antigens located on the surface shell of the virus, hepatitis A antigen, and IgN malaise antibodies to hepatitis B core antigen are the most significant serologic markers. The presence of these markers establish the disease of hepatitis. You see, so you have the antibody surface antigen plus the IgM malaise, meaning that the disease is ongoing. To detect HCV antibodies, HCV infection, blood is tested for anti-Hep C antibodies to Hep C recombinant core antigen, NS3 gene, NS4 antigen, and NS5 antibody. The antibodies can be detected within 4 weeks of the infection. To identify the actual circulating virus, the HCV RNA test is used. The presence of hepatitis D virus can be confirmed by the identification of intrahepatic delta antigen, or more often by a rise in the hep D virus antibodies titer. This increase can be seen within a few days of infection. Hep E testing is usually reserved for travelers in whom hepatitis is present, but the virus cannot be detected. Hep E antibodies are found in people infected with the virus. Other diagnostic assessment, liver biopsy, may be used to confirm the diagnosis of hepatitis and establish the stage and grade of liver damage or cancer. Characteristic changes help the pathologist distinguish among a virus, drug toxin, fatty liver, iron, or other disease. So, the priority collaborative problems for patients with hepatitis B include weight loss due to complications associated with inflammation of the liver, and fatigue due to infection and decreased metabolic energy production. Planning and implementing the solutions and take actions. The plan of care for all patients with viral hepatitis is based on measures to rest the liver, promote hepatic regeneration, strengthen immunity, and prevent complications if possible. So how are we going to promote nutrition? The patient with hepatitis, especially A, may decline food because of general malaise, anorexia, abdominal discomfort, or nausea. The patient diet should be high in carbohydrates and calories with moderate amount of fat and protein after nausea and anorexia subside. So we need to wait for the anorexia to subside to change the diet. Small, frequent meals are often preferable to 3 standard meals a day. Ask the patient about appealing food preferences because favorite foods are tolerated better than randomly selected foods. High-calorie snacks may be needed. Supplemental vitamins are often prescribed. Interventions. During the acute stage of viral hepatitis, interventions are aimed at resting the inflamed liver to promote hepatic cell regeneration. Rest is an essential intervention to reduce the liver's metabolic demand and increase its blood supply. Complete bed rest is usually not required, but rest periods alternating with periods of activity are indicated and are often enough to promote hepatic healing. Drugs of any kind are used sparingly for patients with hepatitis to allow the liver to rest. An antiemetic to relieve nausea may be prescribed. So basically, they are treating the symptoms again. However, because of life-threatening nature of chronic hepatitis B and C, a number of drugs are given, including antiviral and immunomodulating drugs. These are the examples of the most common drug therapies for chronic hepatitis B and C. So you have tenofovir, adefovir, lamivudine, entecavir. Okay. If you see the 4 of them, you have to monitor for kidney function. Adefovir, besides the kidney function monitoring, you have to know that the drug is excreted through kidneys. Monitor for renal impairment is important. So that is an important factor to know. Okay, important. Chronic hepatitis C, you have second generation protease inhibitors, NS5A inhibitors. These medications are very specific and um, are used in a specific settings by very specialized gastroenterologists. Okay, it's good to know. HCV viral genotype, chronic hepatitis A and C. All these drugs can affect the immune system and make patients susceptible to infection. Teach patients to avoid crowds and people who are infected. Okay. Another thing to know, very important, is the HCV genotype, the hepatitis C genotype. Treatment is based on genotype. There is no hepatitis C vaccine immunoglobulin. This is very important to know. So for hepatitis C, the treatment is based on genotype. There's no hepatitis C vaccine immunoglobulin. Chronic hepatitis B and C, all these drugs affect the immune system. We spoke about this. Similar to patients with other chronic diseases, patients with hepatitis often use complementary and integrative therapies to promote general well-being and improve quality of life. Examples include herbs and vitamin supplements, including silymarin, which is milk thistle plant, nowadays very popular in functional medicine to treat liver conditions and to promote a healthy liver. Green tea and vitamin E. The effectiveness of these substances has been well researched. Avoid crowds also is very important to know in patients with Hep B and C. In general, right? Very important to know. Care coordination and transition management. A primary focus in any case is preventing the spread of the infection. For hepatitis transmitted by the fecal oral route, careful hand washing and sanitary disposal of feces are important. Teach the patient with viral hepatitis and the family to use measures to prevent infection transmission. In addition, instruct the patient to avoid alcohol and check with the primary healthcare provider before taking any medication or vitamin supplement or herbal preparation. Can you imagine you're having Hep B and C and also you're going to start drinking alcohol? Encourage the patient to increase activity gradually to prevent fatigue. Suggest the patient eat small, frequent meals of high carbohydrate foods and plan frequent rest periods. Collaborate with the certified infection control practitioner and infection disease specialist. So the goal is to maintain adequate nutrition, to report increasing energy levels as the liver rests, achieve appropriate management of infection and inflammation. And with this, we're done with the hepatitis topic.